Good afternoon. I am Brianna Speneliazo. So let's discuss about the sodium glucose good transfer inhibitors. What is SGLT2 inhibitor? So it is a class of drug that lower your blood sugar levels by preventing your kidneys from reabsorbing sugar that is created by your body, and the extra sugar leaves through in your urine. And then canagliflozin, so it is also used to lower the risk of heart attack, stroke, or death in the patient with type 2 diabetes and heart or blood vessel disease. So this medicine works in the kidney to prevent absorption of glucose or the blood sugar. Canagliflozin is the brand name. Generic is Invokana. Dosage is 100 mg to 300 mg. And then for the route is PO. And then for the frequency, it's once daily. And then for the classification mechanism of action, pharmacology class, sodium glucose co-transfer to inhibitor. Therapeutic class is anti-diabetic. Action inhibits SGLT2, which reabsorb glucose filtered by the kidney, increasing amount of urinary glucose in that is excreted. And then for the indication, adjust the diet and increase to improve glycemic control in patient with type 2 diabetes. To reduce the risk of major adverse CV events in patient with type 2 diabetes mellitus and establish CV disease. Also to reduce the risk of ESRD, doubling of serum creatinine level, CV death, and hospitalization for HF and diabetic nephropathy with albuminuria greater. And then for the contraindication, contraindicated in patient hypersensitive to drug or its component and those with severe renal impairment or ESRD and in patient on dialysis. Drug isn't recommended in patient with type 1 diabetes mellitus or for treatment for diabetic ketoacidosis. And then drug isn't recommended for patient with severe hepatic disease. And then for the adverse effect, CNS, fatigue, asthenia, syncope, postural dizziness. For the CV is hypotension, orthostatic hypotension. For the GI is thirst, constipation, nausea, abdominal pain, dehydration, and pancreatitis. And then for the GU is genital fungal infection, UTI, increased urination. And then for the nursing responsibility, before is monitor patient for infection, new pain or tenderness, and sore or ulcer of the lower limbs. And then observe for hypertension during therapy, and then monitor blood glucose level. And then after is the patient teaching will counsel patient about the increased risk of lower limb amputation. Also advise patient to discontinue the drug and immediately report hypersensitivity. And then for the contraindication, continuation drug increases serum creatinine level and decreases GFR. Patient with hypovolemia may be more susceptible to this change. Used cautiously in older adults, in patient with volume depletion, impaired renal function, chronic low systolic BP or hypotension, and in those on concurrent diuretics. For the adverse effect continuation, vulvovaginal pruritus, renal impairment. For the hematologic, increase HB level. Metabolic is hypoglycemia, hyperkalemia, and then for the musculoskeletal, bone fracture, and then others is hypersensitivity reaction and fail or falls. And then for the nursing responsibility continuation, reaction and generalized or urticarial rash. Caution patient to avoid dehydration with can cause hypertension. Advise patient to use care during first few weeks of therapy because of an increased risk of falls. The paglaflozine, it is used to reduce the risk of worsening kidney disease, the need to be hospitalized for heart failure, and the risk of death due to heart disease in adults with kidney disease. Brand name is the paglaflozine. Generic name is Farxiga. Dosage is tablet 5 mg to 10 mg. And then for the route is PO. And then for the frequency is once daily. For the pharmacologic class, sodium glucose co-transfer to inhibitor. Therapeutic class is anti-diabetic. Action is inhibitors of sodium glucose co-transfer inhibitor. These reduce reabsorption a filtered glucose from the proximal renal tubule and lower the renal threshold for glucose, resulting in increased glucose excretion. And then for the um, indication, adjust the diet and increase to improve glycemic control in the patient with type 2 diabetes. Also to reduce the risk of CV death um, and hospitalization for HF in patient with NYHA class 2, 3, or 4. HF with reduced ejection fraction. And then for the contraindicated is patient being treated for glycemic control without established CV disease or multiple risk factors. Patient with ESRD or who are on dialysis, and the patient with a history of serious hypersensitivity reaction, and then anaphylaxis, and then an angioedema. And then for the CV, volume depletion, dehydration, hypovolemia, orthostatic hypotension. And then for the EANT, um, nasopharyngitis. Um, for the GI is nausea, constipation. For the GU is genital mycotic infection, and then UTI. And then before, monitor glucose level